clinical placement, especially the very few days, is one of the most difficult moments in the life of a nursing student. This goes as far as the very first day that you start practicing as a registered nurse or a nurse assistant or a practical nurse. Now, there are a lot of controversies that come with this, because if you are doing internship in your own teaching hospital, it's a little bit better because you are versed with the workers, you are versed with the environment, you are versed with the people, and it becomes very easy for you to easily integrate into the healthcare system and move on. But now the fear and the real problem comes when you're going for your clinical placement in an environment you have never been there, or in a hospital you have never been there. So it brings this fear, it brings anxiety. People are anxious. You are afraid whether or not you're going to be loved, or they are going to hate you. You are afraid whether you will be an access to the healthcare team, or you'll just be a liability. You wonder if your knowledge is good enough for you to be in that environment, and if the people you're going to work with are going to calmly welcome you and take you into the healthcare system as though you are one of theirs. And especially to the nursing students, we have that complexity and this fight or these discrepancies between the nursing students and the senior workers. Yes, everybody in their internship had 1 or 2 episodes of having a clash with a senior worker. Either or not you caused it, or the senior worker for some reason decided not to like you. So this is why and most of the times we come back to ask, but what is wrong with the senior nurses? Is it that they are threatened with the presence of the young nurses, or is it that they don't just like young nurses? Especially when you're just coming from school and you start working, and then you bring this fresh knowledge out of school, and then you're trying to integrate it into the healthcare system where you are working, you become a threat automatically. You get statements like, we have always been doing this, it has always been done for decades, it has always been done, but nobody is ready to make a change. I think the healthcare system somehow has grown so big that we are now accepting, we are now coming to a realization where we want to grow, and we want to grow in a very positive way. So these are some of the things that put together, you are so scared. You are scared of starting a new job. You are scared of going for placement. You're wondering, you have so many questions. Here, this picture you're seeing here is the very first day of me going for my own clinical placement. And lucky for me, being in the Catholic hospital, being in a Catholic school, we had a teaching hospital that is in Shisha. So we just left school and then went to our first placement was in our own teaching hospital, where we were versed with the environment, where we knew some of the nurses, where we know the environment, we know the people. So it is easy to integrate, and then you are just like, okay, you already have favor by some and loved by others, so it is easier for you to move in. On this day, my first placement, I was placed in the pediatric unit. And believe you me, there are 2 units when you have to start your placement in. It makes your stress, your anxiety, and your fear goes from 15 to 100. If you are placed in the pediatric ward, or you are placed in the maternity, if that is your first placement department, it's like you have ×5 of the very problems that each and every other person has. Because the tenderness, you're wondering if you're soft enough, you're wondering if you're kind enough, you're wondering if your smile is beautiful enough, you're wondering if you are not just afraid to integrate in the nursing system, you're not just afraid to integrate with the nurses, you are equally afraid to integrate with the babies. Because you can just enter a ward and the child just like, bah! They start shouting. Now, how do you manage that? On the very first day that I had my internship, we lost a baby. And that was a devastating moment in my life. The very first day. And then as early as 9, I think it was about 9:30, 9:45 in the morning, they brought this baby to the hospital. The baby was they consulted by the pediatrician before they brought the baby for a insertion of a cannula and then drug administration. They realized that the baby was getting agitated, and before you knew it, everything was gone. We are even still struggling to understand what is going on, the confusion, the report, the handover, the report writing. Everything is confused. Everybody is so preoccupied, and they are just moving left and right and east and west. And then you are standing there, and then there's a dead body, and then you don't even know which direction you belong. That day, I prayed that somebody save me. If I was not called to be a nurse, if this was not something I wanted to do the rest of my life, I tell you that same day, I will never come back. I called my mother. I'm like, we are bereaved. She was, who died? I said, I lost a baby this morning. A baby. It was so devastating. I cannot figure out how many days when I go to the hospital, the senior nurse that had that baby in her hands while the other was speaking. Each time I look at her, I see that baby in her hand. This is how traumatizing it could get. To those that start in the maternity, imagine going to observe a delivery when you have never seen this before. It just leaves an everlasting thing that keeps swinging in your head. You keep wondering, oh, am I going to go through this? But I tell you that in as much as we have fears, we have anxiety, we have worries, we have every other thing, it is needed so that you become a better nurse. It is needed so that you become a good person. Because if you don't feel this pain, if you don't feel this anxiousness, if you don't feel the anxiety, how then do you want to understand when a patient tells you, I'm afraid? When a patient tells you, I'm anxious? When a patient tells you, please just give me 1 more second. Let me still think if I have to go for ECS. So getting into our topic for today, which is the top 10 clinical placement tips for nursing students. First, welcome to my channel. I'm Nurse Aisha. This is your very favorite nurse. And today we are going to be looking at the 10 clinical placement tips to help nursing students crack an easy integration into from school to the workplace, to see and to understand perfectly well what is happening, and to able to go for placement with full confidence, understanding that there are stages and there are steps to this, and you need to get yourself prepared mentally, psychologically, physically, financially before you go into your clinical placement. Please, if you're joining my channel for the very first time, I'm Nurse Aisha. Do well to leave a like if you find this content interesting. Down here, you see the subscription button, or maybe it's down here. Yes, down here, you're going to see the subscription button. Please do well to subscribe so that each time I upload my video, you'll be the first to be notified. And don't forget, turn on your notification bell so that as I drop, you will be the first to see. And if you're my returning subscriber, I want to say thank you. Let's start with number 1. Do your common research. Do a common research of the environment you're going to, of the community you are going to, of the clinic you are going to, of the hospital you are going to, the type of shift that is offered in that hospital. That is to say, if it is a 2-shift system, if it is a 3-shift system, if it is an hourly system, you need to understand which system is operating in the hospital, because this is going to permit you to do your follow-up. This is going to permit you to know when and how to go to work. This is going to permit you to examine yourself physically, mentally, if you are capable, if you are strong enough to take those long periods, or to look for another clinic where they have a shorter duration of work shift. Because like in my place of work, we are having 2 shift system, morning and evening. The morning starts at 7:30 a.m. and ends at 5 p.m. While the night shift starts at 5 p.m. and ends at 7:30 a.m. That is minus or includes minus the time that you do your handover, because the handover starts exactly at 7:30 and it might finish at 8 or 8:30, depending on the number of patients that we have in the ward and the severity of their disease conditions or the interventions that were carried out that might lead you to overstay the period of handover. Number 2, you will need to research on which common disease conditions you have in that environment. So if it is an environment where we are having a lot of malaria cases, a lot of typhoid cases, or you are in an environment where we have a lot of HIV cases, we have a lot of hepatitis cases, this is how you are going to be relating to the information that you get. You already know the people. You already know the disease conditions that are easily found in this environment. And then it is going to prepare you to know the type of drugs that will be used in that hospital, or the type of drugs that will be mostly used in this hospital. You equally need to know how to calculate your drug dosage. And we know here that the normal formula for the calculation of dosage is the desired dosage over the available dose multiplied by the diluent. So this is the formula for you to calculate your dosage of medication. It is very important, especially when we are dealing with children, that you calculate your medication correctly and you give just the dosage that is required for the individual. Most and famously, when we are dealing with antibiotics, you don't have to go wrong. When we are dealing with pyretics, you should give the right dosage, because in as much as they are good, they don't act well. Too much of it might affect the child's or the person's liver. You need to understand your clinical environment. Yes, you need to be able to go around, you need to be able to find time, you go around the hospital and see for yourself which environment you're going to be working at. If it is a very big hospital, you need to be able to identify where you are going to start. Because if you are going to start in the medical ward, in the surgical ward, in the maternity, in the gynecological ward, or in the pediatric ward, or at the OPD, and then you don't even know where the OPD is, and it's a very big hospital. So which time are you going to locate the OPD before you start going early? It's going to take some time. So it is necessary that you get familiarized with the environment that you're going to be working with, so that it eases your movement in and out of the hospital and give you that period of time to gain time and gain access to the medical system and get access to your place of placement. Number 2, time management. Time management is a very crucial aspect when it comes to health. My famous teacher said, life and death is a difference of 1 second. So if life and death is a difference of 1 second, what will happen if you come to the hospital late or always comes late? That simply means that you as an individual is capable, just by being late, of killing a patient. Yes, a patient just lost their life because you were 1 second late. It is crucial, and because we are going to be early on duty for the rest of our lives, it is better as a nursing student you start it now. Now, not going on duty is not just about getting to duty on time, it's equally closing on time. Because if you go to work on time, and while we are still struggling to do VATAs, to do drug administration, to write the report for the day, you disappear. Yes, because most nursing students, when you have realized that there are too many students on duty, there are too many students on placement, you make yourself invisible. You go into the hospital and go out as you like, because you know you will not be noticed. But I tell you, do not fool yourself. Remember, you are for placement because your parents have paid money for that. And nursing school and the fees is not as easy as other schools. So if your parent could afford 350,000 CFA francs, 400,000 right up to 500,000 CFA francs for you to be able to go to school, my dear, use that time preciously, because they might be going through day and night to be able to afford that much for you to go to school. So while you are on placement, make sure every second counts. Learn as much as you can. Go to work on time and leave when it is needed. As a nursing student, you are not supposed to leave the hospital when the senior nurses are still there. So until the last senior nurse has changed, you are not supposed to leave the hospital. Yes, you are supposed to keep working, and you are supposed to participate in the handover. You are supposed to go to the rounds, and then you go home when the senior nurse tells you it's time. Please don't take this to be too demanding. Those are the things that you have to do. Of course, the senior nurse will go through each and every one of these steps before the individual is going home. So get used to it, and get used to it now. Being late is not just wrong, but being late is disrespectful for both yourself, the administration, and the senior nurse to whom you have been put under their care. Because if I am in the hospital as early as 7 o'clock and a student nurse is coming to the hospital at 8, doesn't speak well of you. And if you keep doing that, it will equally not speak well of me, because they might feel like I'm not teaching you enough, or I'm not correcting you enough, and that is why you keep doing what you do. So it is necessary, especially when you get into an environment where there is high level of accountability, that you too be accountable for your own deed. You should be responsible enough, and you should be conscious enough to understand that it is necessary for you to be at work on time, and it is necessary for you to leave when it is due. Number 3, prepare your materials. Now, most of the clinical environments that you'll be going, especially here in Cameroon, they will request you to submit a packet of gloves. They will request you to have your own BP machine. They will request you to have your own stethoscope. They will request you to have your pens, your different colors of pens, and not come to work and beg from others. So yes, you should be able to keep all these materials. You should be able to prepare all these materials to have a smooth integration into the health system. You are not a senior nurse, so you are not supposed to be using their own machine. You are supposed to use your machine to practice. So get your BP machine, get your stethoscope, get your pens ready, get your glove, or submit your glove to the health setting which you are going to perform your clinical internship. And most importantly, give your objectives. Always submit your objectives to the senior nurse or the lead nurse or the major of the hospital so that you can be followed up and your objective will be attained to one after the other. Most of the time the student comes and we don't even know what their objectives are all about. So you just go into the hospital and start cleaning and start doing births and start doing this and start doing this. At the end of the day, you go home, you are not able to pick a vein, you are not able to do IM injection, you are not able to calculate your treatment or to calculate drugs, you are not able to do shit. You are not able to do anything except for bed making, except for cleaning of bed pans inside the sleeves, except for carbonization, except for doing minor things. Not that these things are not important. No, they are important aspects in health and we must do them. But then do not focus your mind on doing these things without giving us the objectives that you came for. If you had to do 2 circumcision, you should be able to do those 2 circumcisions. If you were supposed to observe 10 circumcisions, you should have observed those circumcisions, because whether or not you know it, these circumcisions are being carried out in the hospital. And if we do not know that you are supposed to observe, how are you going to be sent to the environment where will permit you observe a circumcision? If you are supposed to observe 20 deliveries and conduct 3 or 4, we should know that this is part of your objective and will send you to the environment where it will permit you to conduct these deliveries, conduct 4 or 5 deliveries by yourself. Let us know so that we can send you in an environment that will permit you do that. But if you come into the hospital without any objectives and keep moving left and right, east and west, that is where you are going to be. Number 4, write down drug names. This is a very important aspect of your clinical internship. From the very first day that you are on internship, you should be able to write down medication and their usage. And so as you see new medications, if you get to a clinical environment, you already know that this environment is having an epidemic of malaria and typhoid. When you get the very first day, you start taking your artesunate, your quinine, your ceftriaxone, cefexime, your ciprofloxacin, your metro. Have the medication, have the class, have the type of medication that you are using. That is your medication, the type of medication, probably the class, and then what the medication is used for. So in a section of your small jota book, which every student going for internship should have, a jota book that is capable of fitting in your pocket. Because don't have the ones that you be keeping in the nursing station. At the end of the day, when you come back, you say, no, I will write it, and then you don't write. Have the one that is inside your pocket so that it will ease you to just write as you go. When you are able to have that, on the very first pages, keep some few lines just for medications, their dosage, their some medication, their dosage, what they are used for, and their classes. This is going to help you build a portfolio of medications for yourself. This is going to help you build a background, a base data for pharmacology. Now, if you have already treated artesunate, you know that artesunate is an antipyretic that is used for malaria treatment. You know that artesunate is 60 milligrams per dose. You know that artesunate is used for the treatment of malaria. This already will stick into your brains. You talk about ceftriaxone. What is ceftriaxone? What is it used for? Which class is ceftriaxone coming from? Is there anyone that is contraindicated for ceftriaxone? You know this. As you are solving number 1 and you're going, you bring drug number 2, you bring metro, you bring anagin, you bring eferagan, as you are bringing all this medication one after the other, it permits you to study them gradually. And when you get to your level 200 or your level 300, pharmacology is not going to be a problem for you. Because you already have a base that you created by yourself. Now, when you go, they start telling you Cipro is an antibiotic from the cephalosporins. It's not going to be a news. It's not going to be any good, any new news to you, because you already know that ceftriaxone is an antibiotic. It's used in the treatment of typhoid, and it belongs to the group of cephalosporins, which is what the second groups of cephalosporins. So these are certain things that you should know. These are certain aspects of medications that you should be versed with. It should be easier to come by, because you are gradually gathering your medications and gradually taking note of them. Now, we are not saying that you're going to know all the medication in the world. Of course, medication, every day we still have new medication. But then in the environment where you're going to, are you able to identify the medications that are mostly used there? What are their dosages? What are they used for? And how are they used? That is going to be very important. Number 5, ask many questions. Ask as many questions as possible. Be that one student that will be like, senior nurse, Nurse Aisha, what is this? What is this? Nurse Aisha, what is this used for? Nurse Aisha, what is this used for? It is not a disturbance. It is not a disturbance. It is your own environment where you need to learn. So when you want to do it, learn as though you mean it. Learn as though you enjoy it. Do not worry yourself on whether, if I ask too many questions, they're going to look at me at the time. No. Every senior nurse wants you to ask questions. But then if you come and you don't ask questions and you just keep looking at places, how do you want us to help you? How do you want to be helped if we don't know exactly what you lack, what you need, what you don't understand? Not saying that we are not going to teach. We are definitely going to teach you as much as we can. But then it is in your own place to now get in and understand that maybe this, I did not understand this one very well. I did not understand this one very well. I need to ask questions. It's for you to take assignments. You go and do them. You come back with your questions. I did this assignment. I did this assignment. I think I understand here right up to this level, and this on this other side, I did not understand anything. Please, can you explain? So these are some of the things that are going to help us to be able to help you. So help us. Ask questions. Ask questions. Ask them again. Keep asking questions. When we give answers, keep them in your brain, because it is equally exhausting for somebody to ask you, what is artisanal used for? Or how do we calculate artisanal? You give them the formula, you give them examples, they do it, and then the next day you ask the person, calculate me artisanal, and they have no idea. It is exhausting. So make sure that you are a student who is capable of learning, who is capable of asking questions, and who is capable of retention. Don't just ask questions. When they ask and they tell you, retain it. Go home, revisit your notebook, understand what you did for that day, and then you are able to move for the next day. Equally, always be curious. Come forward. Nurse, today we are in the afternoon period. We have finished treatment. We have this. What else can we do? And then she'll be like, oh, we needed to check this particular patient. Go and check the patient. You are creating your own connections and you're creating your own bonds with the nurses on duty. Oh, nurse, the bed in ward 2, or the bed in female ward, or the bed in ward 5, there was 2 beds in there that were not being capitalized. Can I do it? And she says, yes. Prepare like this, prepare like this. Let's go together and let me teach you how to do the capitalization. Or let's go together so that we can do the capitalization. Or if you have been taught, okay, you can prepare and go and do the capitalization. Each time the nurse wants to send somebody, the nurse will be looking at you. Because everybody wants someone that is an active participant. Participate in the care of the patients, participate in the care, participate in taking care of the environment, of the people, of making work easy for the nurses, even if you are a level 1 student. Make work easy. And when you make work easy, each time a nurse wants to send somebody, they'll call you. And if they think it's something that they need you to explain, they will explain. And this is your environment where you learn and learn and learn again. Number 6, show initiative, especially ensuring that you have good time management. Now, each and every hospital has a way in which they do their planification. they plan for their medications, they plan for their the timing of medication, they plan for time for wound dressing, they plan for time for baby's bath, they plan for time for rounds, they plan for this. If you already know your environment, when it is approaching time for medication, you walk to the student nurse, to the senior nurse, like Nurse Aisha, Nurse this, Nurse that, Nurse Frederick, please, it will soon be time for medication. Should we get ready? Should I prepare the trays so that we'll give? Should I prepare the treatment cups? Of course, other hospitals have treatment cups. Should I prepare the treatment cups so that we can go for treatment? Should I prepare the trolley? Should I prepare this? It is time for wound dressing. What should I do? Should I get the instrument from the autoclave? Can we start this? Can I prepare this? This makes the senior nurse know that you are anxious to learn. This makes them understand that you are ready to learn. This makes them know that you came prepared. You came as a vessel that wants to be filled. And I tell you, they will fill you. They will fill you with knowledge. They will fill you with love. They will fill you with attention. They will fill you with help. You need to understand that. Now let's go to number 7. Dress appropriately. It is important that as a student nurse, when coming to the hospital, you dress appropriately. You dress as though you mean it. You have to dress, if your school has a scrub, you dress in your white scrub. If your school has a gown, you dress in your gown and put on your crown. You need a wash. You dress appropriately. If you have to dress in the nursing shoes, the nursing slippers, put them on. If it requires that you have to come with black shoes, wear black shoes. If it says that you have to come with brown shoes, wear brown shoes. Please, the healthcare has so much work that nurses do not have time in telling you which dressing you should not hold. The easiest thing to be done is you came in wearing the wrong pullover, you came in wearing a wrong uniform. They will simply ask you to go home. No time for questioning. So please, save yourself. Number 8, put your hand for opportunities in situations where questions are asked. Yes. So when they ask this, what is the function of diclofenac? You raise your hand up. Diclofenac is used as an anti-inflammatory as well as an anti for pain management. So now that you already know the functions of this medication, you just raise your hand and say them instead of saying within your team members, and it looks like somebody is asking you not to speak. And most importantly as well, do not take the opportunity of your colleague, of your mate from learning. That is to say that if the senior nurse decides to ask a particular question to a particular student, please, even if you know the answer, allow the person whom they have identified to answer that question to do so. Because if the senior nurse could ask that particular individual to answer that question, that simply means that there is something she wants to get from that person. She might have taught that person that topic the previous day and wants to reassure that that information was well passed. And then you cut them short. And this is going to hinder your mate from learning and from having corrections from something that they did not understand better, or from something that they would have shown their skills and understand their capability of consuming the knowledge that was given to them the previous day. So never take an opportunity away from your mate or your colleague that is meant for their growth and for a better understanding for something they did not understand. Go to number 9. Number 9. Be aware that not all nurses are the same. So you will come to the hospital, you will see 4 or 5 teams that are working. In our hospital, we have 3 teams. And for each team, we have 3 senior nurses. So because you're under this team and this particular senior nurse is giving you knowledge, is teaching, is making sure that you guys understand, is coming to ask questions, is giving assignment, does not make the senior nurse who does not ask these questions a bad person. You should get that in mind and have peace. It does not mean that the senior nurse who does not teach is a bad person. It simply means that you have been given the opportunity to learn from nurse 1, nurse 2, nurse 3 in their different environment and in their different expertise. Because that nurse that does not teach might be able to answer your questions or might be able to demonstrate to you what you are lacking. That nurse that does not talk too much might be able to answer your questions correctly, might be able to give you assignments, might be able to control your assignment. So you should be able to identify which senior nurses am I working with. What does this one do that this one does not do? And what does this one do that this one does not do? And then you take that environment, you take that opportunity to grasp knowledge from each and every one of them and use it to better yourself. Instead of going around and saying this other nurse does not have your time, or this other nurse does not do this, or this senior nurse does not want to teach you, when for sure the senior nurse have a particular thing that they are showing you but you're not seeing because your mind has been crowded with who is wrong or who is right or who is helping you and who is not helping you. So please be open-minded. Know the individuals you're working with and use that opportunity to learn the different materials you take from the midwife, you take from the laboratory technician, you take from the senior nurse, and join them together to make your own nursing practice. Number 10, the last but not the least. When you are asked a question by the patient, do not straightforward tell the patient that I do not know. You are a nurse, and if they are asking you questions, it's because they trust in you and they know that you can help them. So if you come to tell somebody, they ask you, what is this medication used for? You are telling them you don't know. So who are you administering a medication into that you don't know what the function of the medication is all for? So before you do something, you should be able to ask questions. You should be able to get the right information. You should be able to help yourself understand the things that you are doing and what you are doing. But does it mean that you are going to know everything? No. I'm not saying that you are going to know everything. Neither am I saying that you're going to be an expert in doing everything. But what I am implying is that if you are asked a question, what will be your answer if you don't know the answer to that question is telling the patient, please ma'am, I am sorry for now, I might not be able to answer you, but give me few seconds, few minutes, 30 minutes of time, let me go and research on it and come back to tell you. She will definitely accept because patients trust nurses, trust their medical team 100%. And then you go back to the senior nurse and ask the senior nurse on the question that has been asked to you. If the senior nurse understands it and gives you a reply, take that reply, go to that patient and give that reply to the patient. To whom a duty is given, responsibilities are expected. So if you have been given the duty to take care of patients, you should understand that that comes with a responsibility. And this responsibility varies within time, within place, within hour, within circumstances. So please make sure that you carry on these duties effectively. Go to your senior nurse, do your research, come back. Never you been asked a question by a patient, you go and you don't come back to give the patient the answer to that question. So always come back to give that patient the answer to what they have asked. This help them to have more trust in you. This help them to have more trust in the healthcare system that they are getting. They are getting health from or health services from. This help them to understand that you are not just ready to help her regain her health, but you are ready to help her understand her health better and to make it a better and a beautiful place. So yes, do not feel like you are the first person to be a nursing student. We too, one period moment in time, we were equally nursing students. We equally had our own difficulties. We had our challenges, and we struggled to make do with them. And do not feel like you are alone, because you are not alone. There are thousands and thousands and thousands student nurses out there who probably have the same problem as you. So embrace yourself. When coming in, come in being ready to take the challenge. I am telling you that it is not just beautiful a profession you are getting into, but it is a profession that many people will leave their life into your hands. Many people will come giving up. Many people will come in doubt. Many people will bring their problem. You face challenges as a student nurse, as a nurse. But then each moment you should know that you are not alone, because we are a team. We are doing this together. Whether a student nurse, whether a senior nurse, we are all here so that we can make the health system a better place. We are not just struggling on today, we are struggling to make a better tomorrow. I want to be able to be sick and go to the hospital and I'm not worried about who is giving me care. I want to be there just knowing fully well that my health is in good hands, and as I came, I'll go home better and stronger and at peace with myself and my mental health. And this is equally a call to the senior nurses. Please be open. Please be kind. Please be gentle. Please be generous with your knowledge, with your skills, with your know-how. Let's be able to teach the younger ones what good it is to be a nurse. Let not make the profession scary for them, looking like it is a place of war and hate and all the problems that you might ever think of. But let them come in knowing fully well that I'm going into a profession to solve problems, to handle challenges, and to go home being a better person each day. Thank you so very much for being here. If you have watched up to this moment, I say welcome to my channel. I'm Nurse Aisha, your very favorite nurse. So do not forget to leave a like, comment, and subscribe to the channel so that you will be able to get more of this information as the time comes by. If you are a returning subscriber, I want to say thank you. Much love, because it is with you that I'm here today. As long as you keep coming back, as long as you keep coming to get more knowledge, I will get up from my bed and keep doing more. Thank you so very much for being here. I wish you a very wonderful day. Live happy and a healthy life. And do not forget, your mental health is very important. Preserve it as if your life depends on it. Thank you so very much. Have a wonderful day.